Welcome to the University of California Retiree Health Insurance Pre-Retirement Program for UCSC faculty and staff. This video covers the UC Retiree Health Program. I am Marianne McIvor, Healthcare Facilitator at the University of California Santa Cruz Staff Human Resources and Benefits Office. Please note, we are re-recording this video to correct some technical difficulties from the live session. First, some housekeeping. We'll pause for questions at natural intervals. Please place your questions in the chat and keep your line on mute. Please do not share any personal health information. You can also complete a survey to let the UCSC Benefits Office know how to improve future presentations. Today we will cover retiree insurance options, eligibility for retiree health, cost sharing, Medicare, and how Medicare coordinates with UC health plans. Each topic builds on the previous, so I encourage you to hold questions until the pauses. Here is a glossary of commonly used terms. UC is the University of California. HCF is Healthcare Facilitator. RASC is Retirement Administration Service Center. SSA is Social Security Administration, and CMS is Centers for Medicare Services. HMO plans are health maintenance organizations, and PPO plans are preferred provider organizations. UC currently offers continuation of various insurances to eligible retirees. However, health and welfare benefits are not accrued or vested benefit entitlements. UC's contribution may change or stop altogether. This information is current as of the date of this video.
The funding can change, and it does change. From year to year, the premiums change. So that changes the amount of the cost sharing that goes along with those premiums. I just want you to be aware that the retiree health benefits are different than the pension entitlements that you've earned. UC has stated on numerous occasions their intention to continue to offer retiree health benefits. And to keep informed, I encourage you to follow the news on UCNet, become a member of the UC Retiree Association and or the Emeriti Association. And you can also follow news updates on the UCNet Retiree Health Working Group pages there. So, what are your retiree insurance options? This is a listing of the benefit plans that can continue into retirement through your election. And so medical and dental plans can continue within certain parameters in your retirement. The vision plan does not continue through the university, but can be continued if elected by you directly through VSP or Vision Service Plan, our employee vision optical plan carrier. The legal plan can continue there, just as is the case when you're employed. There's no UC contribution. So if you elect legal in your retirement, you are paying the you're paying the premium for the legal plan out of your pension income. Accidental death and dismemberment, or AD&D, can be continued with no UC contribution via direct enrollment with Prudential. Same applies for life insurance. When your employment ends, your employer-sponsored life insurance coverage ends, and you can convert that into an individual policy. And supplemental health plans, those plans carried by Prudential, such as hospital indemnity, emergency, those can be converted into individual plans at retirement. So those are the plans that can continue, and I'm going to talk about those more in depth as we go forward. So the most important plans are the health plans. So the three most critical health plans retirees are interested in continuing are the medical, dental, and vision plans. What can you elect during open enrollment? You can elect medical, dental, vision, and legal, and any other plans announced at open enrollment. The university provides open enrollment opportunities to change their health plans. So the retiree open enrollment occurs on the same dates that employee open enrollment occurs. So you can expect, just as has happened over the course of your UC career, that the benefits office and the office of the president will make information available to you and invite you to learn more through mailings and presentations led by our office. That will continue into retirement, and I offer retiree open enrollment presentations that speak just about the plans that retirees are covered by. The calendar and the rules for retirees are generally the same as for employees. those active faculty and staff can make changes outside of open enrollment when there's a life event, such as a new marriage or a new baby is born or new domestic partnership. In those cases, outside of open enrollment, you are responsible for self-identifying within 31 days of the event. So if you have a new marriage that occurs, for example, within 31 days, you contact the Retirement Administration Service Center, or here comes that acronym, RASC, and ask them about your options to change health plans because of that life event. Other insurance options, while maybe not as critical, are still sought after, and a retiree can continue other health and welfare insurance plans they had as an employee, as outlined on this slide. So the legal plan can continue. It'll deduct from your pension income. Life insurance plan and accidental death and dismemberment plan are available to convert into a individual plan where you direct pay to Prudential. The same applies to supplemental health plans. That's the hospital indemnity, the critical illness, and emergency plans under the supplemental health program. Disability insurance ends with when your employment ends, because the disability insurance is insurance on your paycheck. It provides replacement income if you're unable to work. When you leave UC employment to retire, you no longer have a paycheck that you are insuring. Pet insurance can continue into your retirement with the same advantage of the UC negotiated rate. You just make your payments directly to Nationwide. And the flexible spending account, so the health flexible spending account and the dependent care flexible spending account, those plans end when employment ends. COBRA is available to elect for the health flexible spending account without the tax advantage. And if you have questions about that, you can contact me individually. If you attended a preparing for retirement session, you are familiar with the two options for receiving your retirement income. If you didn't attend that presentation, you can visit the shr.ucsc.edu page and go to the benefits workshops to view a recording of that session. I believe those are up, or they're scheduled to be up very shortly. We are going to have on March 18th at 5:30, there is a presentation on the preparing for retirement. So if you haven't attended that session, there's ongoing presentations available, and I do encourage you to make yourself available to attend one of those. But briefly, there's two options for receiving your retiree income: lump sum cash out or monthly pension income. If at retirement, you opt to select the lump sum cash out rather than a monthly income from UC, the retiree forfeits eligibility for any UC-sponsored health plans, both at the time of retirement and into the future. That is a permanent election. So if you're in this meeting about retiree health, I presume you plan to elect monthly pension income. If you plan to elect the lump sum cash out, there's really not much point in attending this presentation, because all that follows is going to be available only to members that elect monthly income. And so what are the other eligibility requirements for retiree health? Well, let's go through the list. So you have to be enrolled or eligible to be enrolled in UC employee health coverage, and you have to have attained 10 or more years of UC retirement plan service credit to have the minimum eligibility. Your retirement date must be within 120 days of leaving UC employment, and you must choose to receive your pension income as monthly pension income. This doesn't apply to savings choice participants because there is retiree health available to savings choice participants. And so those folks don't get monthly pension income. They get savings income. I am reaffirming, there's no UC retiree health available if you elect a lump sum cash out, just like I said a minute ago. And if you are rehired after your prior separation, so you left UC employment and then come back, you have to work at least 12 months or more in an eligible position to become re-eligible for retiree health. And once you are retired or at the point of retirement, if you become eligible by age for Medicare, you must enroll in Medicare and assign it to your medical plan. And this applies to all dependents that you cover under your health coverage, or your medical coverage, I should say. So those are the rules for being eligible for retiree health. And who else is eligible to be covered along with you? It's the same group of people that are eligible while you're employed. So your spouse or a domestic partner, children up to age 26 are eligible, grandchildren that are your tax dependents, legal wards that are eligible to age 18. And if you have a child that has a disability that began before their 26th birthday, their coverage can be continued beyond age 26. You have to take action to certify with your medical plan that the disability began before age 26. And if that's your situation, you're welcome to reach out to me for assistance with that. I've also linked to the group insurance eligibility fact sheet for retirees, and this is also in the appendix as well. As I mentioned briefly before, there are some enrollment changes that are eligible for retirees to make. It's, again, the same rules that apply to active faculty and staff. There are events that occur in everyone's life that allows them to make changes around their health plan coverage. And these are most commonly fall into the categories of marriage or divorce, or adding a new family member through birth or adoption, taking on the tax dependency of a grandchild. Those are all situations where your needs may change around your health plan coverage. If you're moving out of California, then that would be a time when you would want to look at your health plan coverage. Does it continue to meet your needs? Are you going to need to change to a different plan? If you have health plan coverage through a spouse or a domestic partner and that coverage ends, that is a situation where you can make changes to your UC retiree health coverage. And in those cases, again, it's your responsibility to contact the Retirement Administration Service Center, RASC, within 31 days of the event to make those changes. You are allowed to suspend your UC medical or dental plan coverage in lieu of having coverage through a spouse, and then re-enroll in that coverage or your eligibility as an eligible if that other coverage to come to an end. Again, your responsibility to contact RASC within 31 days. And outside of those life events, you can make changes every year for no reason at all due to the annual open enrollment period. That is provided to allow folks to make those changes for any reason or no reason. While you're working for the University of California, you earn retiree health service credit. And service credit is earned anytime you are employed and compensated in an eligible position. A UC retirement plan and savings choice service credit are both earned based upon the percent time worked in that eligible appointment. The retiree health service credit is earned and will be used to determine your meeting the eligibility requirements and the percentage of UC's contribution towards the cost of the retiree health options. If you separate from UC employment and elect a refund of your UC retirement plan accumulations, or you elect a full refund of your savings choice balances, you forfeit the service credit and you will not have any eligibility for UC retiree health. So now that I've discovered the what, the next question that often comes up is the how much. And the answer to that is it depends. So there's a couple of variables, or more than a couple of variables that determine what you pay for UC medical and dental coverage as a retiree, and they're listed here. Variables include the cost of the plan. What's the monthly premium for the plan? Different plans have different costs. The UC's real premium costs are determined annually. So even as you know what percentage you're eligible to receive towards the cost of your coverage, your real costs will actually vary from year to year because premiums do change from year to year. Your costs are also determined by your retiree health group and whether you retired in group 1, group 2, or group 3, which I'm going to go through in just a few minutes. Another variable is who else is covered besides you. Are you covering a spouse? Are you covering children? Those all go into determining what your costs are. And then also whether or not Medicare is part of the picture. Are you or a family member eligible for Medicare? And have you coordinated that coverage? Your costs tend to go down a little bit with Medicare contributing towards the cost of medical expenses. So I've linked on the slide a resource, which is the UC Retiree Premium Estimator, and it's also linked in the appendix that follows this presentation, so you can see what the costs are. The costs are always current year. We don't yet know what the costs will be in 2027. Premium information is released in mid to late October each year for the following year. So before we go into the retiree health groups, I'm sharing the strategy for retiree health cost sharing. So the UC Retiree Health Working Group established several years ago a maximum contribution for retiree medical plans. And the idea is that by making this strategy very public and structured, that UC could ensure sustainability going into the future. So that Retiree Health Working Group established that the UC's maximum contribution towards UC medical coverage is equivalent to 70% of the aggregate cost. So that means across all health plan, all medical plans, and all levels of coverage, self plus spouse, self plus children, family, all of those different things kind of aggregated into one aggregate cost, and then UC will cover 70% of the aggregate costs. So put another way, if you're eligible for 100% of UC's contribution, you are eligible for 100% of that 70% contribution towards the cost of coverage, leaving you with 30% that is deducted from your pension income. Hopefully that makes sense. We're gonna talk about numbers as we go forward, but the idea is that the UC covers the lion's share of the cost of retiree coverage and asks retirees to also contribute towards the cost of coverage from their pension check. So I mentioned earlier that there is 3 retiree health groups. So they are broken down into those that became active retirement plan members before January 1, 1990. Group 2 is those that became retirement plan members between January 1, 1990 and June 2013. And those that came to UC retirement plan membership or returned following a break in service after July 1, 2013. And so if you first became an active member of UC or Savings Choice based upon the date you were hired or rehired into a UCRP eligible position after a break in service of more than 120 days. So let's go down into the groups. This is our oldest group that's still working for us, and it's very easy to remember. If you entered the UC retirement plan before January 1, 1990, and you haven't had a break in service since that time, you're eligible for 100% of UC's maximum contribution towards medical and dental coverage. Many of the folks that qualified under Group 1 have retired by now. So the lion's share of folks working now for UC fall into Group 2. And these are folks that became retirement plan members between January 1, 1990 and June 30th, 2013. This is also listed in the Retirement Handbook, which on page 16. And if you were hired within those dates, to receive the maximum UC contribution, you need to retire with 20 or more years of service credit. You attain eligibility for retiree health with 10 years of service credit. And if you retire with 10 years of service credit, you have eligibility for 50% of UC's maximum contribution. So 50% of that maximum 70%. And it increases by 5% each year between 11 and 20, maxing out at 20 years. Here's another major group of retiree health. This is Group 3. These are folks that joined the retirement plan or became a savings participant or were rehired after a previous break in service on or after July 1, 2013. So for Group 3, it's both age on the date you retire and years of service that determine UC's contribution. You have to have attained at least 10 whole years of service credit to have minimum eligibility. And you have to have attained at least age 55, but ideally age 56, because retirees that are younger than 56 are eligible to enroll in UC-sponsored coverage, but don't receive a UC contribution. So again, your age on the day you retire and your years of service determine the amount of UC's contribution. Essentially, UC's contribution is at 5% at age 56 on retirement date and increases incrementally with age and service credit to the maximum amount, 100% eligibility, at age 65 with 20 years of UC retirement plan service credit. This is absolutely a retention tool. UC has made this change effective 2013 in order to retain faculty and staff in their position to attain the age 65 and 20 years of service retiree health eligibility for 100% of UC's maximum contribution. So again, you don't have to do the calculations yourself. The retiree medical and dental premium estimator is available to help you estimate what you would pay in 2026 if you were to retire. And so you can visit the retiree medical plans cost page that explains this strategy and click from there on the retiree health premium estimator. And this is updated annually with new rates towards the end of the year. But if we want to do a contribution example, I have some examples over the next few slides to help just kind of add on to the concepts that I've talked about. So this is an example of a typical retiree cost for a person that has attained 20 years of service and they have achieved 100% eligibility for UC's maximum contribution. So using that example, the total monthly premium for their medical plan is $2,000. UC's maximum contribution is equivalent to $1,400. And that means that the remaining amount, $600, would be deducted from the monthly pension check. That's how it works. Here is an example of that same premium amount, but looking at somebody who has fewer than 20 years of total service. So some examples of how UC contribution is applied for retirees eligible for 100%, 75%, and 50% of the UC contribution is listed on this chart. Let's say the full premium for Self Plus Adult enrolled in UC Blue and Gold is $2,000 per month. Again, these are just hypothetical. UC's maximum contribution is $1,400. So if you're eligible to receive 100% of UC's contribution, $600 is deducted from your pension income. If you're eligible to receive 75%, UC pays $1,050. And you pay $950 per month. Moving over to the rightmost, the one on the right, the column on the right, if you're eligible to receive 50% of UC's contribution, your share is $1,300 per month, and UC pays $700, which is 50% of the maximum contribution of $1,400. So as this chart illustrates, your costs can go down substantially if you stick around to obtain those service credit requirements of 20 years. By continuing UC service to maximize UC's contributions, you have lower deductions from pension income, which is the entire endpoint of the graduated eligibility formula. It's to encourage employment retention. So I mentioned that premiums are deducted from your monthly pension income. The plans that you elect are automatically deducted. And if you are eligible for a Part B reimbursement, which can apply, then that Part B reimbursement, which I'll explain in just a few more slides from now, is applied or added to your pension income as a separate line item. So if you are eligible for a Part B reimbursement, that means that the cost of your medical plan is less than what UC has budgeted. So you'll see a $0 for deductions from your UC pension income for medical coverage, and you will actually see a separate line item, Part B reimbursement, added to your pension income. This applies to some plans, HMO plans, and the UC Medicare PPO without prescription drug coverage. But the point of this slide is that deductions and additions are going to be applied to your pension income. Separate and apart from your pension income, there are Medicare premiums that are due. premiums for Medicare can be deducted from your individual Social Security benefit income, your monthly Social Security payment. But our premiums for Medicare are never deducted from your UC pension income. In other words, once you retire, you can receive two streams of revenue. One stream is your pension income. Another stream is your Social Security income. Your Medicare premiums, if they're due, which for most people they are deducted from your Social Security income. UC does not enroll you in Medicare, nor does UC ever pay your Medicare premiums. That's an individual responsibility. And if you're electing to defer your Social Security, taking your Social Security benefit, but you want to enroll in Medicare, that's absolutely fine. You can do that. And in that case, then you can enroll in Easy Pay to have your Medicare premiums deducted from another revenue source. I'll talk about that when we get to the Medicare plans. With moving on to how premiums are paid, there are some plans that you can participate in, but they require direct payment. In other words, these deductions do not come out of your pension income. This would be for the Retiree Vision Service Plan or VSP plan, the optical plan, accidental death and dismemberment, AD&D, and life insurance. Those can be elected by you, but they cannot be deducted from your pension income. You have to direct pay. Same applies to pet insurance and supplemental health. An option that is infrequently used is the option to port life insurance or supplemental health coverage. That's the accident, critical illness, and hospital indemnity plans. So I've placed those in gray ink on this slide. The same option in post-retirement relationship applies to those plans. You, the retiree, elects portability option, and you have to elect that after your separation within 31 days. In that case, the premiums are paid directly to the insurer. That would be Prudential. So I'm going to just pause and look over at the chat to see if there's any questions that came in.
There's one question that came in, Marianne.
Okay, let's see. Which is that about the blue and gold, or sorry, which question?
It was about underwriting.
Is underwriting needed when switching plans during annual open enrollment period? The answer is no, because the university has a retiree health program, so there is no medical underwriting. The university negotiates with these insurance carriers, and so no medical underwriting is required. Is my domestic partner currently covered by our health plan eligible for retiree health coverage? Yes, that is correct. Your domestic partner, if as they approach their 65th birthday, if you are still working and covering your partner under employer-sponsored medical coverage, your partner should contact the Social Security Administration to ask it about their responsibility for enrolling in Medicare. And I will talk about that when we get to the Medicare slides. We will have the slides sent out based on a Group 3 formula. 65-year-old with 10 years of service is eligible for 50%. I don't have those memorized off the top of my head, so please do visit the Retiree Health Estimator tool for that calculation. It's difficult for me to run a program and perform calculations at the same time. Thanks for understanding. Okay, take a quick sip of water, and we're going to move on to UC and Medicare coverage. So this slide just shows what a Medicare ID card looks like, showing the effective dates for both Parts A and B coverage. Often these dates are identical, but if a person was covered by an employer group plan past age 65, they could be different. For example, if you are working now and you're over 65 years old, you may have chosen to enroll in Medicare Part A while you're working and defer enrolling in Part B until your retirement, and that's absolutely fine. So let's get on and talk about Medicare. So first, UC requires all retirees and family members that are covered under retiree health coverage to enroll in Medicare if eligible. Failure to do so can result in penalties imposed by the Centers for Medicare Services and penalties and eventual disenrollment by UC Retirement Administration Service Center. Coordinating your UC medical plan with Medicare helps sustain the retiree health program for all members. So this is why the University of California requires that retirees enroll in and maintain their Medicare coverage. You can become eligible for Medicare based upon your own work history or that of a current, former, or deceased spouse. If you are eligible for premium-free Medicare Part A, the university requires that you must enroll in Part B unless you're still working. And we'll discuss that in more detail later. If you are not eligible for premium-free Medicare, say you didn't work in the United States for at least 10 years, or you don't have a spouse that makes you eligible, or there's a couple of scenarios where you could be not eligible for premium-free Medicare Part A, then you can provide documentation of that fact to the Retirement Administration Service Center, RASC, and that will excuse you from having to enroll in Medicare. If you are unable to prove that you're not eligible for premium-free Part A, then you have to enroll in Part B and provide proof of that coverage to RASC and coordinate that coverage. If you're still working past age 65, employees may delay enrollment in Medicare Part B and Part A, for that matter, until you retire, and you will take action to enroll in Medicare as part of your retirement process. If you are covering a domestic partner and that domestic partner is approaching their 65th or has passed their 65th birthday, that your partner should contact the Social Security Administration to inquire about their responsibility for enrolling in Medicare. The reason is that the IRS treats domestic partners differently than spouses, and where spouses can qualify for deferred enrollment in Part B without penalty, just like employees can, domestic partners do not have that same protection. And so your partner should contact Social Security Administration to ask about enrolling in Medicare when they turn or are approaching their 65th birth date. So what is Medicare? It's an insurance plan that began in 1965. Original Medicare is made up of Medicare Parts A and B. It's a federal insurance program, just like any other insurance program. It just happens to be offered by the federal government, and it was and is intended for those age 65 or greater, and some disabled Americans and those with end-stage renal disease or ALS, sometimes called Lou Gehrig's disease, can also qualify. Medicare, original Medicare pays for some, but not all medical bills. Medicare covers some, but not all preventive services. All of Medicare coverage is based upon medical necessity, and original Medicare is the foundation for a sustainable UC retiree health program. I'm going to break down to the parts of Medicare over the next few slides. The takeaway from this slide is that Medicare is a federal insurance program, and also that UC does not and cannot enroll you in Medicare. Just like paying your taxes, enrolling in Medicare is an individual responsibility. So who qualifies for Medicare? Anyone that's worked in the United States for 40 quarters or 10 years. They are qualified for enrolling in Medicare and paying no premiums for Part A. In other words, the premiums that have been paid via Medicare taxes deducted from compensation, employment compensation, throughout those 40 quarters or 10 years qualify you for premium-free Part A. Even if you're not coordinated by yourself, you can have through your employment at UC, say you opted out of Medicare participation because you were hired before 1986, you can have 40 quarters through your non-UC employment, such as consulting contracts or as a grocery bagger when you were a teenager. All of those quarters count and may add up to 40 quarters in total. You can be qualified for premium-free Medicare through a spouse, a former spouse, or a deceased spouse. So if you are uncertain if you qualify for Medicare, I cannot tell you. You need to contact the Social Security Administration to inquire on your eligibility for Medicare. If you indeed do not qualify for Medicare, premium-free Part A, you do have to provide a proof of ineligibility to RASC to avoid UC penalties for not enrolling in Medicare at age 65. And so I recommended that you contact the Social Security Administration to find out if you're eligible. But I do want to make a distinction. Social Security is not Medicare. So Social Security Administration has a couple of responsibilities around Medicare. They will assist you with enrolling in Medicare, and they will assist with collecting premiums for Medicare from monthly Social Security income. However, your eligibility for Medicare is distinct from your participation in Social Security. Enrolling in Medicare is required around your age 65th birthday if you're retired, but you can choose not to take your Social Security monthly income until a later date of your choosing. So one does not enrolling in Medicare does not require you to start to take your Social Security income, although you certainly can. The qualification for Medicare eligibility is determined by the Social Security Administration. So you will receive a documentation if you are eligible or ineligible for Medicare. And to receive that information, I encourage you to visit the Social Security website, ssa.gov, for individual Medicare determination. And I will take this opportunity to warn you to be very vigilant in lookalike websites. Only visit the .gov websites for your determination on Medicare eligibility and anything to do with Social Security. The .com websites, those are sites that are trying to sell you something and usually are trying to look like there's something that they're not. So be very wary and be vigilant. We all have to do our part to avoid identity theft and other, unfortunate crimes. So if you're thinking about Medicare enrollment, when do I have to do it? When you turn 65, if you are still employed and covered by a UC medical plan, you do not need to take an action to enroll in Medicare Part B because you're still employed and your employer-sponsored medical coverage is your primary coverage. So the takeaway is that if you're working past age 65, you can defer enrolling in Medicare Part A and Part B, or you can enroll in Part A and defer enrolling in Part B, the part of Medicare that has a monthly cost to it, until you actually retire. If you're covering a domestic partner, again, that partner should contact the Social Security Administration when they turn 65. When you are working, you can choose to enroll in Medicare Part A because there's generally no cost associated with that. It's just going to sit there as secondary coverage. It probably won't do much unless there can be some marginal savings on the copay for a hospital stay if you're covered under an HMO plan, but the Medicare Part A is just secondary coverage to your UC employer-sponsored medical plan until you actually retire. If you are enrolled in a health savings account, then you want to avoid enrolling in Medicare until your retirement, because enrolling in Medicare, even Part A for the premium free, is prohibited if you're also enrolled in a health savings account. When you retire, age 65 plus, or you turn 65 after retiring, that is the time that you sign up for Medicare Part B, and you fill out some forms to coordinate your UC retiree coverage with Medicare. So in a nutshell, UC doesn't have a part in your enrollment in Medicare. That's an individual responsibility. And you can delay enrolling in Medicare A and B until retirement, or you can enroll in Medicare Part A only. There's some exceptions. Your domestic partner, once again, they got to contact Social Security Administration at their 65th birthday. If you're in a medical plan with a health savings account, so at UC, that's the Health Savings Plus plan, you want to delay enrollment in Medicare Part A and B until you actually retire. And if you have any questions, you can contact the Social Security Administration and you can reach out to me, or you can contact the Retirement Administration Service Center. Once you are retired, about 90 days before your 65th birthday, or about 90 days before a dependent family member's 65th birthday, RASC will send you a sequence of letters actually, informing you of the responsibility to enroll in Medicare and complete some forms to coordinate coverage with Medicare. So you can expect that once you are retired, these will not happen while you are still working. If you retire before you're eligible for Medicare, you'll receive instructions from RASC detailing your responsibility to enroll and the form to return to RASC. If you are age 65 plus, or you're covering a family member that is age 65 plus, then you will have some work to do as part of your retirement process. And at that time, you are welcome to contact me. Contact your campus healthcare facilitator. That's me, to obtain the form that will provide proof of employer-sponsored coverage after age 65. That's called creditable coverage in the insurance lingo. And that is going to be what is asked for if you are leaving UC employment age 65 plus, or you have a family member that's over 65. Through that action, the person who is over 65 is going to transition from the non-Medicare plan to a Medicare coordinated plan. So if you're covered under an HMO plan, you're going to transition to a Medicare Advantage plan. If you're covered under a PPO plan, you will transition to a Medicare supplement plan. I will talk about those in greater detail in a few more slides. Before we go, we're going to talk about, well, what about split families? There's some people that are over 65, some people that are under 65. Totally understand that. That is a common thing. How does it work? This slide explains the logic. There are Medicare partner plans for each non-Medicare plan. If you're not yet, for any family member that's not yet Medicare eligible, you or your dependents remain in the commercial version of the plan. You remain in the HMO or the PPO, while the person that is eligible for Medicare goes into either a Medicare Advantage plan or a Medicare supplement plan. For example, if while employed you're covered by UC Blue and Gold, in retirement, those individuals with Medicare eligibility are placed into the Medicare Advantage plan, UC Medicare Choice. So there's a plan for all of these scenarios. And if you are retiring age 65 or plus, just know that that will be part of the process that is included in your retirement process, and it is described in the retirement handbook. Again, paying for Medicare is an individual responsibility. And I've mentioned this before, but I'm saying it again because it's somewhat common for folks to contact me after retiring to ask about Medicare premiums. And the truth is that each individual is responsible for paying their own Medicare premiums. UC does not pay your Medicare premiums. Often, Medicare premiums come from your Social Security income. They can be billed via quarterly invoice, or you can enroll in Easy Pay if you're not taking your Social Security income. The point is, if you're eligible for Medicare, you have to maintain your Medicare coverage, and to remain eligible, you have to pay those premiums, and they will be billed to you or taken out of your Social Security income. So how does one sign up for Medicare? The easiest way is to go through the online enrollment. That's the preferred method. Once the online enrollment application is processed, a representative contacts you via the contact information that you provide to obtain the supporting documentation, such as the form that asks for proof of employer-sponsored coverage, the form that I provide to you. And if you need that form, you can absolutely contact me and I will give you very detailed instructions. And you can find a link to that form in the appendix. This is the website that I mentioned that is the place to get started with Medicare. I think that, in my opinion, I think that the online tools have improved significantly over the last several years. And so I do encourage you to engage with the Getting Started with Medicare page. This is linked in the appendix of this presentation. And again, it's an individual responsibility to enroll in Medicare when eligible. And you can get started at the website, the Social Security website, or the Medicare website. I like this site because it really takes you through some steps to get you on the right path. And again, as you're seeking resources, stick to the .gov sites for the best information. Those are the places. .gov websites are going to have bona fide information that's gone through legal. There's a lot of information out there, so I encourage people to stay with the .gov sites. Social Security Administration also has YouTube videos that are, I think, very helpful. Again, stick to only those that are produced by the Social Security Administration. And here's that link to the Getting Started with Medicare. It's also linked in the appendix. So we talked a lot about Medicare. Let's break it down a little bit more. So Medicare is a federally run insurance program that's made up of three main parts and another part that I'll go over the next few slides. Part A is hospitalization. This is financed by payroll taxes. If you're eligible to receive it based upon your own or your spouse's contributions, you don't pay Part A premiums. Part B is medical services. This is the part of Medicare that requires a monthly premium payable by you. And the university, again, does not pay those premiums. These two together, Part A and B, are called Original Medicare. Part C are Advantage plans. I have this in gray because it's really a different type of plan that I'm going to talk about in a moment. And it's not a component of Medicare. It's Medicare Advantage plans are plans offered by private insurers, and I will talk about them as we go along. Part D is also in gray because it's also not part of Original Medicare. It's bundled with plans offered through the University of California, and it's also offered by outside of UC by private insurance companies, and I'll talk about it in greater detail. Part D can provide or can require additional premiums payable to the Centers for Medicare Services for high income earners, and I will talk about that as we go along too. But the point is that parts C and D can be fulfilled by the University of California's Retiree Health program. And so parts C and D can be provided through UC. A and B is provided through CMS. So let's go even deeper. So Part A, I mentioned that's hospital insurance. It covers hospitalizations, including stays in skilled nursing facilities. Say you have a surgery or an injury that you need to recover from. You don't need to be in the hospital, but you do need to be somewhere where you can have care. That's a skilled nursing facility. Hospice care for end-of-life care and some home health care, including some durable medical equipment, can be covered under Medicare Part A. The Medicare Part A premiums have been paid over the course of your career in the United States through Medicare taxes. And if you're qualified for Part A, then you don't pay any premiums for Part A. Part B is the part of Medicare that people use most frequently. It's for medical services. So that's things like physician office visits, outpatient care, lab tests, durable medical equipment, crutches, wheelchairs, diabetic testing, strips and monitors, physical, occupational, and speech therapy to recover or from an injury or a serious medical event, and some preventive or wellness services. These are the Part B is the part of Medicare that people use most frequently. Medicare Part B has a monthly premium payable by each individual, and higher income earners will be charged a higher premium based upon income. The Part B premium pays for itself because Medicare is taking the burden of higher cost non-Medicare coverage. So the Part B premium is determined by the cost of medical care. And so the Part B premium can fluctuate from year to year. Normally, the Part B premium is announced in early December for the next year, and it represents the 25% of the cost of funding Part B. So when Medicare costs go up, it's because the pool of Medicare enrollees have had experienced higher medical costs. In 2026, $202.90 per month per person is the base Medicare Part B premium. It can be higher depending upon your income. The Social Security Administration will be able to tell you the exact amount you pay for Part B. There is a chart for 2026 premiums provided in the appendix of this presentation, and that is available for you to access. I mentioned that some higher income earners can pay a higher Medicare Part B premium. And this is based upon the Medicare Income Related Monthly Adjustment Amount, or IRMA. And it's basically a look at the IRS provides to the Social Security Administration your modified adjusted gross income. If your modified adjusted gross income is above a specific dollar amount threshold, you can be subject to a higher amount. For example, if you are filing singly and you earned more than $109,000 in 2024, you can be subject to a higher Part B premium in its different amount to $218,000 if you're filing a joint return. So again, there is the chart in the appendix that gives those income thresholds, and that is a Medicare production, and it is publicly available. I've linked it in the appendix. I will say that there is also a form linked in the appendix that allows you to request a reconsideration if you had a one-time income increase, such as, sale of a major real estate or something like that would have cost your income to be artificially high 1 year. You can request for review, and that is also linked in the appendix. Part C of Medicare. It refers only to the Medicare Advantage insurance plans run by private insurance company as authorized by the Centers for Medicare Services. So they are Medicare-approved plans from a private company that offers an alternative to original Medicare for your health and prescription drug coverage. So Part C of Medicare is not really a part, it's actually a plan that's authorized by the Centers for Medicare Services. And UC offers 2 Medicare Advantage plans. Once you are enrolled in one of these plans, you cannot use your original Medicare separately. You have instead assigned your Medicare risk to the plan that you have chosen to enroll in. And UC offers 2 Medicare Advantage plans. These are UC Medicare Choice, PPO. It's the partner plan to the UC Blue and Gold, and Kaiser Permanente Senior Advantage. And that's the Medicare partner plan to Kaiser Permanente HMO. So again, the Part C refers to a specific type of plan. If you're enrolled in a Medicare supplement plan or a Medigap plan, you do not have a Part C plan. And then there's Part D. What about Part D? Part D is simply a prescription drug program. Part D is really a mechanism by which prescription drug coverage is paid for, and the prescription drug coverage is actually offered by private insurance companies authorized by the Centers for Medicare Services to provide that coverage. And UC employs a couple of, our medical plans provide the Part D coverage. Prescription coverage must meet or exceed CMS requirements to be called creditable coverage. And all of UC's medical plans do provide creditable coverage, except for the UC Medicare PPO plan without prescription drug coverage. Obviously, as the name implies, that plan does not provide prescription drug coverage, so it is not credible credit coverage. That plan would be elected by an individual if you are electing to have prescription drug coverage outside of UC, or you have prescription drug coverage available through another avenue, such as TRICARE for Life, if you are retired from the armed services. So what does creditable coverage mean? It just simply means that you have coverage that is expected to pay out as much as the standard level of coverage set by the federal government. And that qualifies as creditable coverage. So when you are covered under UC retiree medical plans in Part D, you need to fill out a coordination form to align your UC Part D plan. And it's part of your retirement process when you're retiring age 65 or plus. When you're approaching your 65th birthday, you'll be sent the form. Information about Medicare Part D in coordination with UC plans is provided to you by the Retirement Administration Service Center. And the takeaway is that you should not take action to enroll in a non-UC Part D plan without consultation first. You can enroll in a non-UC Part D plan during the open enrollment period and then choose the UC Medicare plan without prescription drug coverage and provide that proof of coverage to the RASC. That's allowed during open enrollment. But if you take action to enroll in a Part D plan outside of UC and you already have a UC plan with Part D coverage, that is not allowed. And that can cause the cancellation, the termination of your UC coverage. So if you want to change your Part D around, that's fine. You can do that, but just do it from an informed space. And I'm happy to talk with you about that if that does come up as a situation. But in my experience, the overwhelming majority of UC retirees elect to participate in the Part D plan through University of California, so it's not really an issue. I talked a little bit about Medicare Part B for higher income earners. Again, I just want to point out that the 2026 Part D premiums kind of work the same way as the Part B premiums. You may be subject to higher Part D premiums based upon your modified adjusted gross income 2 years prior. And that can also be reconsidered if you have an abnormal tax year. So when you're covered by Medicare, you must receive care from your Medicare providers or physicians that accept Medicare. There are a subset of providers that accept Medicare, but don't accept assignment, which means that your responsibility to pay will be higher. But they do accept Medicare. If you're enrolled in the original Medicare program, it's important to ask your doctor to see if they accept assignment or they accept Medicare before you receive care, because this can have an impact on what you will be responsible for paying. And I can't change that. It is your responsibility to pay those charges. So it's a good thing to ask. But the overwhelming majority is that of providers in the United States, somewhere around 96% accept Medicare. And there are some physicians that do not accept Medicare. And for those physicians, neither Medicare nor the UC plans will pay for those services, except unless specifically provided for. An example could be a licensed therapist or an acupuncturist. Those are generally not covered by Medicare, but can be covered by your UC plans. The takeaway is ask before you receive care if that provider accepts Medicare. And I am able to confirm that all of the local medical groups, Dignity, Kaiser, PAMF, they do accept Medicare assignment, Stanford as well. So you don't have to ask them because I've already informed you that they do. And I will break for questions. Let's see. For someone who is 65 plus, who is about to retire from UC with a spouse who is still employed at UC and is dependent on the spouse employee's health insurance, when should they enroll in Medicare Part B? I think you're telling me, Brent, that you are each individually covering yourself. And so all of the presentation today is about a person that's going through the retirement process. So if you're going through the retirement process and you're 65 plus, enrolling in Medicare will be part of your retirement process. If your spouse is individually eligible and enrolling themselves, if they retire after age 65, enrolling Medicare will be part of their retirement process. If they retire before age 65, they will enroll in Medicare in retirement. Let's see. Next question. UC Medicare Choice includes prescription drug coverage. So aside from filling a form for Part D, do we need to do anything else? No. That's pretty much it. When you are covered under the UC Medicare Choice, there's a form for your completion, and that is the form. Second part of the question, is there still a separate IRMA for Part D when one is going with UC Medicare Choice? Yes, there is. So the Medicare Part B premiums and Medicare Part D premiums that you are responsible for paying are subject to modified adjusted gross income. It doesn't really matter which medical plan that you are enrolled in through UC. The fact is that the Centers for Medicare Services have determined income thresholds that make individuals responsible for higher Part B and Part D premiums, regardless of the supplemental medical plan that they enroll in. Hope that helps. Not necessarily the answer that you want, but it is the answer that I've got. Okay. So if anybody wants to get up and have a stretch break, now's the time to do it. I'll just wait for any other questions to come in. Let's see. I don't see any others, but I am happy to take those, and I'm just going to take an opportunity to have a sip of water. And if there's no other questions, I'll jump into the more specific about UC and Medicare plans. So, as I mentioned before, there are Medicare coordinated plans and commercial or non-Medicare plans, and they have differences. Typically, the costs are different, and often service areas and providers may differ. For example, a doctor may accept our non-Medicare plan, but not the comparable Medicare plan. So it's always good to ask when you have a change and talk about strategies. In general, Medicare plan costs are typically less than the non-Medicare plans. So typically, Medicare costs are typically less than non-Medicare plans because Medicare is now contributing to lessening the costs to the UC, even factoring in the monthly Part B premium. The net expenditure for health care can be less than before coordination with Medicare. And some upcoming slides will show these calculations. So please forgive the repeat of prior information. To confirm, Medicare enrollment happens when a person is first eligible. And for most people, that's at age 65. And people working past age 65 enroll in Medicare when they leave UC employment, including to retire. So it's in your UC retirement that you enroll in Medicare. And some family members will remain in the non-Medicare plan because they aren't yet eligible. So in that case, there is no difference in the plan than the plan while employed. They have the same plan. If you are not eligible for Medicare and you retire with UC Blue and Gold, your UC Blue and Gold continues in retirement without changes. It's really a Medicare eligibility that the change comes. And when Medicare enrollment is completed, there's coordination to do with RASC. The easiest way to coordinate Medicare coverage with UC coverage is to use UC Raise. For retirees with Medicare eligibility, the coverage will be under Medicare Advantage plans, Medicare supplement plans, often called Medigap plans, or it can be, if you're residing outside of California, a Medicare coordinator plans. So I'm going to go through these in greater detail. But first, some things to consider in the open enrollment before your planned enrollment date. This is a great time to look at the retiree information. If Medicare is in your future, look at the Medicare costs for the Medicare plans. So just to kind of recover, things to consider before you're retiring as you're planning to retirement is that open enrollment is a good time to look at plans for the next year. You should also be aware that not all primary care physicians can accept new Medicare members. Some providers in the Santa Cruz area are saying they can no longer accept new Medicare members. So are you considered a new patient? If you haven't seen your doctor in 2 years, you may be considered new, even if you consider yourself a continuing patient. So if you want to continue with that doctor, connect with that doctor before you turn 65 to maintain that relationship. You should be aware that Medicare service areas may differ from non-Medicare plans. A prime example is Monterey County residents are affected by Kaiser. Kaiser is not licensed by the Department of Managed Healthcare to provide Medicare services in Monterey County. And so if you are a Monterey County resident or you live in San Benito County, you can, and you're enrolled in Kaiser while you're employed, the Kaiser Permanente Senior Advantage Plan may not be available to you in your retirement. So contact me if that is your situation. And if you are planning to retire in the upcoming July, then you're in the right place. But if you're still a few years off, pay attention during open enrollment to the Retiree Health Program, and you may want to attend a retiree open enrollment presentation. UC and Medicare plans can provide an opportunity for a Part B reimbursement. This occurs in certain scenarios, not every scenario. It occurs when the UC contribution that the University of California has established is greater than the monthly premium cost for the actual plan. In that case, then UC returns the difference to the retiree as the Part B reimbursement. Currently, in 2026, this occurs for members enrolled in Kaiser Senior Advantage. The Part B reimbursement is not considered pension income, and it can and does change from year to year. The Part B reimbursement is payable when a retiree or dependents enroll and coordinate UC coverage with Medicare. And since the UC requires that eligible enrollees enroll in Medicare, the Part B reimbursement is intended to defray or offset the Part B premiums that the individual is required to pay. So it's not available for everyone, and the Part B reimbursement is not a fixed line item, but exists whenever the cost of the Medicare plan is less than the amount that the UC has established for its retiree health medical plan premium payments. So this is an example of a Part B reimbursement. If you're enrolled in Medicare, monthly premiums you're responsible for paying generally go down. So that monthly premium can be $500. But the UC can have established $640 as the amount that it will pay, the amount it has budgeted towards the cost of retiree health. In that case, the Part B reimbursement can be $140. Generally, if you don't have 100% eligibility for UC's contribution, if you have instead 75% or a lower percentage, then the Part B reimbursement becomes more unlikely. For example, using that same amount, the premium $500, the UC contribution with a 75% graduated eligibility will be $480. In that case, you get no Part B reimbursement, and it's even that logic follows over for eligibility for 50% of UC's contribution. So the Part B reimbursement really only exists for folks that have many years of retirement service credits and are enrolled in Medicare. Now, if you are enrolled in an HMO and you become eligible for Medicare, then you will be positioned and transformed into a Medicare Advantage plan. So the Medicare Advantage plan will be that Part C plan. And in that case, you have assigned your Medicare risk. So you've assigned original Medicare over to the plan that you have elected to enroll in. The Centers for Medicare Services then pays that insurance plan a monthly fee to manage your health care. And if you have good health outcomes, that company can receive bonus payments. So those plans, Medicare Advantage plans, will be very much encouraging you to receive wellness care, to encourage you to receive preventive health care, and to encourage you to participate in management of serious health conditions such as type 2 diabetes, COPD, other serious health conditions that can result in frequent, recurring hospital admissions. If the Medicare Advantage plan can help you manage those serious health conditions better, they can receive health payments. The Medicare Advantage plans that UC offers provide prescription drug coverage or Part D medical plans. So UC's Medicare Advantage plans have Part D bundled with the plans. Medicare Advantage plans are offered by the University of California without underwriting. So I'll take this moment to address that Medicare Advantage plans are having a moment in the United States and that they are being scrutinized. And I think that scrutiny is really good. For the UC program, the Medicare Advantage plans do not require underwriting, which can be a frequent issue that's brought up in the national discussion about Medicare Advantage plans. This chart shows the Medicare Advantage plans that you transition to. The differences are few. The name changes, and you'll receive a new ID card with a Medicare Part D logo on it. You must update your health care providers with your new ID information. And there may be some changes in the prescription drug availability because of CMS requirements. Medicare mandates some specific drugs, which may cause different prescription drug coverage. And Medicare Advantage plans are available to California retirees and available in many, but not all California counties. If you live in the Northern California counties or the Eastern California counties, there may be limited options there. Medicare Advantage plans also provide prescription drug coverage, and this chart shows the costs associated under the prescription drug plans. I won't take the time to go through all of these amounts. I'll let you look at that when you receive the slides. But just to know that there is prescription drug coverage that mirrors the coverage available to employees. If you're going from a PPO medical plan, so for example, UC Care, UC Health Savings Plus, you move to a Medicare supplement plan that coordinates with Original Medicare. In that case, Original Medicare is primary coverage. It pays first for Medicare covered services. Then the UC plan is secondary insurance, pays second after Medicare has paid. The UC plan is referred to by the University of California as a Medicare supplement plan. Outside of UC, these plans are sometimes called Medigap plans. And the UC plans are designed to fill in the gaps for things that Medicare doesn't cover, such as the Part A deductible, Part B deductible, prescription drug coverage, and other costs for medical care. So if you're going for a Medicare supplement plan, let's say you're going from UC Care, you will be changed into the UC Medicare PPO plan with prescription drug, and that's carried by Anthem Blue Cross. If you're under the Health Savings Plus, you go into a different plan because the health savings account makes it ineligible for Medicare coverage. And even if a Medicare person isn't you, if it's a family member, you have to choose a different plan. Health Savings Plus is not compatible with Medicare under IRS regulations. This is not a UC rule. This is an IRS rule. And you can continue to use any of your health savings account funds until you exhaust them. The UC Medicare supplement plans, again, are the UC Medicare PPO, UC High Option Supplement to Medicare, and UC Medicare PPO without prescription drug coverage. Again, you must use providers that accept Medicare. And again, the overwhelming majority of medical providers participate in Medicare. UC Medicare PPO and High Option do include prescription drug coverage. So if you enroll in this plan, do not enroll in a separate Part D plan. If you choose to go into the plan without prescription drug coverage, then you will be required to show proof of the Part D plan outside of the University of California to RASC for the RASC to accept your enrollment. And the UC Medicare supplement plans have coverage that covers the services after Medicare has paid. So for UC Medicare PPO with and without prescription drug coverage, there is an annual deductible of $100 that applies, and the plans cover 80% of the costs after Medicare has paid. I'll give you an example in just a moment. With the high option supplement to Medicare, the annual deductible is $50, and that plan pays for 100% of services after Medicare has paid. But wait, before you run out and say, I want to choose that plan, the high option supplement to Medicare is available to choose only during open enrollment. You can't retire into that plan, but you can certainly explore it and enroll in it the next open enrollment period. And you should critically look at that, because if you do a cost benefit analysis, the high option plan may not be your best choice. So to help you with the understanding, I'll move on to an example. This is an example of an office visit under the respective plans. So in this example, I'm using a Medicare allowed amount for a unnamed service, and the cost is $150. So the UC Medicare PPO covers 80% after Medicare pays. So Medicare pays $120. That's 80% of that $150, leaving a $24 balance. Then UC Medicare PPO covers 80% of that remaining $24, leaving you with $6 as your amount that you're responsible for. If you go over to the high option plan, you have the same coverage from Medicare. The balance of $30 after Medicare has paid is $30, and that is paid 100% by UC High Option Plan. So there is no patient responsibility after both plans have paid. What you have to do is look at the premium rates for UC High Option. It is a higher cost plan. So does the additional coverage provide enough to justify the additional premium? That is for you to determine, and you can do that during open enrollment. Prescription drug coverage is next. The UC supplement plans do provide prescription drug coverage. Both the UC Medicare PPO and the high option have the same coverage listed here. If you go to retail, pharmacy, you'll pay an amount. If you go to mail order pharmacy, you'll pay a different amount. If you choose the UC Medicare PPO without prescription drug coverage, there is no Part D plan, and you have to show proof of coverage to RASC to enroll. So what's not covered by Medicare? A lot of things. So this kind of is to justify or point out the value of the UC Medicare supplement or Medicare Advantage plans. I'm not going to go through this list in the interest of time, other than to share that there is a value in the UC retiree health coverage, and when coordinated, it often covers these gaps that are not covered by Medicare. For folks that are going to move outside of California, the university has established the UC Medicare Coordinator Plan. So this is a program that is available for UC retirees that live outside of California, but within the United States, and all family members are enrolled in Medicare. You may not be aware, or you may be aware, that in the United States, the U.S. healthcare industry regulates medical plans on a state-by-state basis. So the UC Retiree Medicare Coordinator Program is designed to allow you to access medical plans that exist within the state that you reside in. And the Medicare Coordinator Program has two components. You have a enrollment support through Via Benefits. So Via Benefits is a firm that UC has employs to run this program, and Via Benefits employs experts that that work and provide support in each of the 50 states and territories. And the university also funds a health reimbursement account of up to $4,000 per person per year to be used to purchase a plan that exists within the state that you reside. If you have money remaining in the health reimbursement account, then that can roll over from year to year, and the health reimbursement account can be used to, pay for copays and things like that. So that is the program that works if you move out of California and everybody is under Medicare. I also like to point out that COBRA notification is a notice that you will automatically receive. The transition from employer-sponsored coverage to retiree coverage is considered a termination of employee coverage under federal labor laws, and you are required to receive a COBRA notice and a medical plan termination notice. But I'm here to tell you, if you're eligible for and enrolling in UC retiree health benefits, you may disregard these notices. I like to share this with you because I often get a panicked call from folks. I'm at the end and of the formal presentation. The remaining information are the appendices of information that